Chronic lymphocytic leukemia. Chronic lymphocytic leukemia, CALLE, is a type of cancer that originates in the bone marrow and affects a particular subtype of white blood cells called B lymphocytes, or B cells. The pathophysiology of CALLE involves multiple genetic, molecular, and immunological changes that result in the uncontrolled proliferation and accumulation of abnormal B cells. CALLE occurs age greater than 50 in 90% of those affected. Many are asymptomatic at presentation with only a markedly elevated white blood cell count. The most common symptom is fatigue. Other symptoms include lymphadenopathy, 80%, spleen or liver enlargement, 50%, infection from poor lymphocyte function, hemolysis sometimes. CALLE has no unique physical findings. Diagnostic tests. The WBC count is usually at least above 20,000 per microliter with 80% to 98% lymphocytes. Half of patients are hypogammaglobulonemic. Anemia and thrombocytopenia can occur from marrow infiltration or autoimmune warm IgG antibodies. CALLE is paradoxical. When the body needs a useful antibody for an infection, it is often not made. On the other hand, the CALLE cells attack normal red blood cells and platelets. Treatment. For stage 0, elevated WBC, stage 1, lymphadenopathy, and stage 2, hepatosplenomegaly, there is no treatment. Stage 3, anemia, and stage 4, thrombocytopenia, are treated with fludarabine, cyclophosphamide, and rituximab. If there is a choice that lists fludarabine, cyclophosphamide, and rituximab, then this is the best initial therapy for advanced stage disease. 3. IV, or any patient who is symptomatic, severe fatigue, painful nodes. Alemtuzumab, anti-CD52, is used when fludarabine fails. Point to remember. Refractory cases. Cyclophosphamide, more efficacy, but more toxic. Mild cases. Bendamustine, elderly, severe infection. Intravenous immunoglobulins, autoimmune thrombocytopenia or hemolysis. Prednisone bendamustine with rituximab equals fludarabine. The prognosis of patients with CALLE varies widely at diagnosis. Some patients die rapidly, within 2 to 3 years of diagnosis, because of complications from CALLE. Most patients live 5 to 10 years, with an initial course that is relatively benign but followed by a terminal, progressive, and resistant phase lasting 1 to 2 years.